I'm going to talk about the different hernia repairs that I do in my practice using mesh. The first is an open technique with mesh. The second is a laparoscopic technique with mesh, and the third is a robotic technique with mesh. I'm going to lump the robotic and the laparoscopic together since they're very, very similar other than the instrumentation that you use. The open technique is with an incision in the groin. You cut through the skin, the subcutaneous tissue, the fascia, and you find the defect, and then you patch the defect. In the laparoscopic or robotic, or shall we say minimally invasive technique, you're looking through the belly button at the back of the abdominal wall, so you don't have to cut through all the layers, you actually see the hole. And the only difference between the two techniques is that in the traditional method, I sew in the mesh. In the laparoscopic, I use titanium staples or tacks, and robotically, I either tack or use sutures. So those are the only major differences. However, there are specific differences after that. All three operations are done as an outpatient basis. You come and go home the same day. All three operations are done without skin stitches, and you can shower the same night of surgery. In all of the operations, we get you on a treadmill at 2.8 to 3.2, a fast walk for 20 minutes the night of surgery, 3 times the next day, 3 times the day after, and by the third postoperative day, you have full unrestricted activity. You can drive, you can do whatever you want, play golf, lift anything you want. The only restrictions for the first 2 days in all procedures is no driving a car or lifting more than 15 pounds or doing repetitive core. Those are some of the similarities to them. However, saying that you can get back to full activity and being able to get back to full activity are two different things. In the traditional method, if I do a patient on Friday, almost everyone is back to work by a week from Monday. Some are back Monday, Tuesday, Wednesday, but almost everyone's back in 9 or 10 days. If I do them through minimally invasive technique, most patients, at least 70%, are back on Monday. In the traditional method, even though I don't restrict physical activity, it takes 3 to 5 weeks to get back to full activity. In the minimally invasive technique, it's usually the following weekend. So the first big difference here is that one hurts more than the other, and therefore the recuperative period is longer. Now we're only talking specifically now about one side, not if you have two sides. The other major difference between the procedures are that the traditional method can be under general, local, spinal, or epidural. The minimally invasive procedures are only done under general anesthesia. Saying that, the risk of general anesthesia in a relatively healthy person is not significantly different from the use of spinal, epidural, or local with sedation. If you do one side open, it hurts a factor of X. If you do two sides because you have bilateral hernias, it hurts 4X because you really don't have a side to take care of yourself, and it hurts on both sides, so it compounds the discomfort. The minimally invasive, whether we do one or two sides, the recuperative period is the same. It doesn't really have any effect at all. So the biggest differences are the method of anesthesia. The second biggest difference is return to full activity. The third issue comes into complications and or recurrences. Is there a difference? I'm speaking specifically in my hands or my studies. Patients can always have injury to blood vessel, bowel, and nerves, but this is very, very low, and certainly under 1% for injury to surrounding significant structures. And it's the same in all three procedures. The traditional method will have more wound-related issues because they might have a 2-inch or 3-inch incision, and that's usually black and blue and swelling, etc. While the minimally invasive, though you can get some black and blue, there's very little local reaction because the incisions are 1/4 or 1/2 inch. So there's a big difference from the patient's point of view. The only other question is recurrence rate. In my series from 2016 of over 1,200 laparoscopic hernias, my recurrence rate was 0.5%. It certainly has not changed over the last 7 years. In an open technique, though we do mostly laparoscopic at the present time, my recurrence rate is in the same range. Robotically, I can only say that we do less with those, and I've done at least 100 to 150 with no recurrences at the present time. If I have my druthers, I'd prefer to do a patient laparoscopically as opposed to robotically, just because it's quick, it's easy, and the approach is a little different from the robotic approach, and I think that it's an easier procedure to do than to do it robotically.